According to Kevin Frederick, Public Information and Communications Officer within the Ministry of Health, current numbers indicate that there is a sharp increase in the reported number of gastroenteritis cases on the island, and as a result, the public must take immediate personal action to curb the outbreak. According to Frederick, in epidemiological week number 26 of 2022, there were 27 cases of the illness.
We have noticed a sharp increase or spike in our data as it relates to gastroenteritis. We have noticed that from week 26 all the way up to week 28, our numbers did rise. And so our latest is that as at week 28, epi week number 28, we have seen a total of 95 cases of gastroenteritis.
On average, the number of gastroenteritis cases that is expected at this time is 50. Frederick explained that there are no identified clusters by location, and most affected districts were St. George and St. Andrew. The ministry's gastro-epi data of week 28 highlights the most affected age groups and number of cases respectively. Under 1 year, 5 cases, 1 to 4 years, 27, 5 to 14 years, 20 cases, 15 to 24 years, 7, 25 to 44 years, 28, 45 to 64 years, 6 cases, and 65 years and over, 2 cases. Given the current upward trend in the data, health experts say they are anticipating an increased risk of people coming down with gastroenteritis in the coming days and weeks as carnival celebrations intensify. He says subsequently the ministry has heightened its public health response, including its public education campaign, which is ongoing as it relates to proper hand hygiene and consumer food safety tips during the festive season, as well as food safety training for street food vendors.
To that, we are advising persons out there to be mindful of what they eat, and so, you know, we do say to people that we know that you are out there liming, and there are a number of street food vendors. So our advice is that, you know, to pay particular attention to the cleanliness of the stalls, you know, ensure that, you know, they are wearing their food badges, you know, that their hair is properly covered, you know, they are washing their hands, they are separating, you know, food, you know, like raw food, you know, from cooked food. They are storing their meats and fries and what have you, you know, properly, and likewise so that they are not handling money and serving food with their bare hands.
In addition, all health districts have stepped up surveillance and management of the illness. Gastroenteritis is a condition that causes irritation and inflammation of the stomach and intestines. It is caused by eating food or drinking water contaminated by a bacteria or virus, or by improper hand washing, especially after using the toilet. Symptoms of gastroenteritis include vomiting, abdominal pain, diarrhea, upset stomach, and stomach cramps. As part of its public health mandate, the ministry says while pipe-borne water is often properly treated, people who feel concerned or collect and store water for consumption and household use should boil their water out of an abundance of caution. Chrislina John, GBN News.